I didn't really know what to do. I was so sick. I literally called friends and said, my kids are gonna find me dead in my bed.
Shannon was a very severely ill ICU patient with COVID-19 pneumonia. And she had not only severe ARDS, but also had acute kidney injury and septic shock.
I remember the coughs were like really bad. Like you could tell something was up and it wasn't normal.
Within a couple days, I was coughing up blood. I had already gone to an ER and had been sent home. They said I was fine.
It just got worse and worse and worse. And especially when she was put on the ventilator, I was like, it just seems like it's a downward spiral. And I was like, in my head, I was like, I don't think she's gonna make it.
She had been at the referring hospital, intubated with a breathing tube in on the ventilator for about a week, requiring 100% oxygen. So her trajectory was poor.
Survival flight got there. They worked on me for a while. I looked improved just from what they had done, and that was why I probably survived the flight.
They're like our angels in the air and on the ground to bring us the critically ill patient in a stable condition so that we can use the therapies that we have here to try to get the patient better. Other hospitals are not ARDS referral centers, and they do not have all of the tools and the specialized training that is required to care for these very critically ill patients.
In the following days and following weeks were just like continuously like fantastic and on such an upward trend, and it was crazy progress.
All the doctors were wonderful. They saved me. So when we pulled into the neighborhood, there was a huge welcoming police escort, best friends, best neighbors. It was a great feeling to be home and alive and to be with my family and to be a mom and not have left them.
Ever since she got home, it's been, some parts have felt pretty normal and some have definitely felt like, okay, like this is the new normal. She's getting mad at me, so I think everything's a little normal there if I'm the troublemaker again. But it's just a huge sigh of relief and all this pressure is gone.
You can die from this and you're not bulletproof. It's pretty incredible I survived, but I very easily could be dead from COVID.
Our surgical ICU team commonly says, we would love to walk every person in the country through our surgical ICU to see a unit full of young, healthy, critically ill patients with COVID-19 ARDS so that it could convince them to get vaccinated.